Hi, good afternoon. My name's Summer. I'm a level one student. I was wondering if I could get a SPA report on your patient.
Yeah, we're
Oh,
taking we're taking care of Greg Lutz. He's a male in room 261. He's like 67 years old. He has no allergies and he has a full code. He came into the hospital with a stage 2 diabetic ulcer on his right heel that he's had for about 3 weeks. He's also been a type 1 diabetic for 20 years. His blood glucose levels are high, they were in the 300s. He is a medium fall risk and high risk for pressure ulcers. His recent vitals, his blood pressure was 128/70, his temperature was 98.4, heart rate 76, respiration 16, and O2 was 96. His most recent blood glucose level was 242, so today we're going to be administering 16 units of insulin according to the sliding scale. He has an IV in his right forearm, and he has a standing order for morphine for every 4 hours for pain. He's been complaining of tingling in his lower extremities, but everything else looks normal. He's awake, alert, oriented, steady gait. His lungs are clear and unlabored. His heart sounds are normal. He has present bowel sounds in all 4 quadrants. No tenderness or distension. He's a non-smoker. So what we're going to do is turn the patient every 2 hours since he's at risk for pressure ulcers. We're also going to monitor his blood glucose levels and his vitals. And today we're going to be administering the insulin. Do you have any questions for me?
Yeah. What specifically is the client, or why is the client receiving the medication? And do you know what does the action of the medication have on the body?
He's a type 1 diabetic, so his body doesn't produce insulin. And what the insulin is going to do is go into the cells and it's going to absorb it for energy. So,
Okay. Why would you, or when would you question administering the medication?
you would not give them a medication if his blood glucose levels were below 70. You'd
Okay.
also want to check for signs of hypoglycemia. That would be altered mental status, like confusion, shaky, dizzy. Also, make sure that he isn't allergic to the medication.
And does it have a therapeutic serum level?
No, it doesn't.
Okay, and what are the vital signs that you monitor and the physiological parameters that you monitor when the medication is being administered?
You would check their blood glucose levels, you'd monitor their heart rate, their blood pressure, their respirations, check for the signs of hypoglycemia.
Okay, got it. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and then also safely at home?
At the hospital, we would monitor his blood glucose levels. We would also teach the patient at home to rotate the sites to prevent skin irritation. You want to make sure that he's storing the medication properly. And then also, before we discharge the patient, you can always make sure you can have him demonstrate how to administer and drawing up the medication.
Okay, and what are the side effects and potential adverse reactions?
Hypoglycemia, and then also the allergic reaction, and you want to make sure that there's no skin irritation.
Okay. And how will you know that the medication is effective?
If he has normal blood glucose levels.
Okay, got it.
All right, now we're going to go into the room and talk to the patient.
Okay.
Come in. Hi, how are you today? Okay. My name's Jamie. I'm going to be your nurse today. I'm going to be administering your 2 insulins.
Oh, great.
Can you tell me your name and date of birth?
My name is Greg Lutz, and my birthday is 11/11/70.
All right, and do you have any allergies?
No allergies.
All right. We're going to pull the 2 insulins. I'm going to check it against the MAR, make sure we have the right ones. We're going to check the expiration date. We're going to make sure we have the right time, route, amount, medication, and patient. And since our scanner is broken, I'm just gonna manually type in the barcode for the medication into the molar. I would also scan the patient's ID bracelet to make sure that I have the right patient. And I'm just gonna compare the one that I have. All right. You also want to go into the drug book. You're going to go to the type of medication you have. You want to make sure, since he's receiving insulin and NPH, that you can mix them. And you also want to make sure that the unit dose corresponds to his weight and that you're giving the right amount.
Okay.
So here, the regular insulin is 0.5 to 1 unit per kilogram per day. So we're going to be giving him 16 units of regular and 20 units of NPH.
Okay.
So that's correct. Alright. Here we have the NPH. I'm going to draw up 36 units of air, so alright. So we're going to put 20 units of air into the NPH. And then we're going to put the rest, which is 16 units, into the regular insulin. Alright, and then we're going to draw up 16 units of the regular. And can I just have you verify that I'm drawing up 16?
Yep. Got it.
And now we're going to draw up 20 units from the NPH. I just need you to verify that too as well.
Oh, sorry.
That's okay.
Perfect.
All right. And then we're doing the one-handed recap method. All right. Do you have a preferred site of injection?
Oh, well, last time they injected on my lower right abdomen.
Okay, so this time we're going to do it on the left side.
Okay.
You know never to inject yourself in the same spot every time.
I think I knew that.
Okay. You just don't want to build up scar tissue and you can become irritated.
Okay. All right. I'll make sure to do that.
All right. I'm just going to wait for it to dry. It's dry. Alright, then we're going to dispose of it into the sharps container. How do you feel?
I feel fine.
Alright. And then you asked about the diabetic teaching as well.
Yes.
Okay.
Uh-huh.
I have a packet for you. Tells you all about the diabetic diet, how you should eat foods that are high in fiber, carbs, lean proteins, fresh fruits and vegetables.
Oh, okay.
So that's for you to read.
Okay,
And
great.
then can you tell me one thing that you learned today about your medication?
Oh, I learned that I should be rotating my sites a little bit better than I have been.
Okay.
To watch out for that scar tissue buildup.
Perfect. All right, your call light is in reach. I'm going to make sure your bed is lowered. I'm going to come back in a little bit to check your blood glucose levels.
Okay.
All right, let me know if you need anything.
All right. Thank you.
Now we're going to document if you want me to show you. So we're going to type up how many units we gave, where we gave it. There's going to be a little green dot next to the medication so that when you scan it, you know that you're giving the right medication.
Oh, okay.
All right.
Alright, excellent. Oh, and I just have a couple more questions. Was there any pertinent pieces of information that you reviewed before administering the client the medication?
Yeah, we checked his blood glucose levels to make sure it was in a safe range that we could give it to him. And we assessed for signs of hypoglycemia and made sure that he had no allergies.
Okay, and did that information affect your decision to administer the medication?
Yeah, based on that information, I was able to give it. If not, if his blood glucose levels were under 70, I wouldn't administer. If it was showing any signs of hypoglycemia, I also wouldn't administer.
And did that information affect how you administered, or like where you administered?
Just based on the patient told me where his last injection site was, so I did it somewhere else to avoid the skin irritation. Other than that, there were no issues.
Okay, cool. Thank you.